Alan Lakin once said, "Failing to plan is planning to fail." And when we talk about fatigue management, it is essential for training longevity. Fatigue buildup is inevitable due to overload. We can separate fatigue into two categories. Acute fatigue is the immediate or short-term consequence after a training session. Chronic fatigue, on the other hand, is dangerous fatigue that accumulates over time. One of the examples of acute fatigue is glycogen depletion. A large amount of glycogen is depleted after an intense session, and it is crucial to replenish carbohydrate after the training. Some of the consequences of body's glycogen reserves drop can be decrease in training intensity and volume, increase in perceived difficulty, and shutdown of synthetic metabolic regulators in the cells, which may lead to muscle loss or stall of protein synthesis. And the main factor that depletes glycogen is volume. Nervous system is the most common chronic fatigue. Chronic buildup of stress and lack of time for sufficient CNS recovery will lead to mental fatigue, and some of the consequences of mental fatigue can include decrease in activation of muscle fiber, decline in coordination between the nerves and the muscles, and drop in CNS learning capacity. And training intensity is the main factor of mental fatigue. Some of the other factors that can lead to fatigue can include imbalance of signaling molecule and hormones, breakdown of muscle and connective tissue structure, and technique like range of motion, optimal lifting path, training age, stimulus, muscle fiber type, and gender. So here are some of the general but essential advice for recovery. We must train within the MRV or recoverable volume. We must have 7 to 9 hours of quality sleep. We must eat enough calorie and absorb enough nutrient like carbohydrate, protein, and fat. We must manage stress from work and relationship, and usage of recovery tools such as massage gun, sauna, foam rolling, and just actively stretching and increase our blood flow can also help with recovery. All right, here's an advanced fatigue management technique: the use of light session and rest day to restore glycogen, deload week to relieve mental fatigue and functions of signaling messenger, active rest to increase blood flow and support the recovery of muscle and connective tissues. Here's an example of what a light session and a deload week might look like. We have different numbers for different periodization block because what we need to focus on recovering is different for every block. For hypertrophy, we're going to decrease our weight just by a little bit, half our set for everything while keeping the rep the same. During a light session, we will keep it around 90%, but during a deload, we want to make sure that it is generally around 60 or 50%. For strength, we're going to keep it around 50 to 80% depending on really how tired we are. And for the sets and reps, it is the same as hypertrophy. For intensity, during a light session, we're going to decrease our intensity even lower. And during a deload, it is the same for 50%. For peaking, we're going to keep the weight slightly lower, but we don't want to keep it too low to the point where we're going to lose those neural drive. For the set, we're really going to decrease it drastically while keeping the rep the same. And for intensity, we're going to keep it at 50%. Some of the common mistakes in fatigue management can include skipping deloads or taking them too late, treating a deload as a medium training session instead of a true recovery session, doing nothing at all in deload. Instead, what we should do is treat deload as a technique week, overvaluing certain recovery gimmicks and undervaluing the general advice such as sleep, diet, and stress management. Next video, we're going to talk about accommodation and variation. Thank you for watching. Don't forget to like and subscribe. See you next time.